A heart attack occurs when a blood clot blocks a coronary artery and starves the heart of oxygen. In medical terms, this condition is referred to as a myocardial infarction, or an MI. Most MIs are a result of plaque buildup on the walls of arteries due to high cholesterol. Platelets, which are the tiniest of the three major types of blood cells, white and red blood cells being the other two, stick to tears in this plaque and eventually form a clot. Before I get into the condition itself, let's go over the basic anatomy of the heart. The heart is composed of 4 chambers, 2 atria and 2 ventricles. The pericardium, a sac-like covering, surrounds the muscle. It beats through a series of rhythmic, complicated electrical pulses that are transmitted from many spots, keeping the beat normal. However, sometimes this electrical circuit is disrupted, resulting in an MI. The symptoms of a myocardial infarction vary. Some victims experience immense pressure and/or pain in the chest, arm, or upper abdomen called angina. Others get very anxious, lightheaded, and nauseous. In some cases, fainting, coughing, profuse sweating, or in other words, diaphoresis, and shortness of breath occur. The first step in diagnosing a heart attack is checking the vital signs. These include pulse, blood pressure, respiration, temperature, and weight. Arrhythmias, or abnormal heart rhythms, can be a key indicator of an MI. Sinus rhythm is the normal heart rhythm, about 70 beats per minute. Tachycardia, a common arrhythmia, is a fast pulse, normally more than 100 beats per minute. This can be a sign of a serious cardiac issue. Bradycardia is the opposite of tachycardia, a slow pulse, normally under 60 beats per minute. This condition can indicate heart block, a problem with the electrical circuit of the heart where it has trouble beating. Blood pressure can be another indicator of a heart attack or other cardiac problem. A blood pressure of near 130 or above is very high, a condition called hypertension. However, this can also be caused by stress, and obviously having severe chest pains or diaphoresis is quite stressful, so it is not always the best way to tell. Hypotension is low blood pressure, i.e., a BP below 90. Heavy breathing can be a symptom of a myocardial infarction because the body is trying to replenish the oxygen that the heart is not receiving. However, the energy to breathe like this uses up more oxygen than is taken in, so patients are often supplied with supplemental oxygen. Temperature is important because a fever can affect the metabolic state of the heart. In other words, the heart would be forced to use more oxygen and energy, which can lead to complications. Weight is extremely important when it comes to treatment. Getting the right amount of medication is vital. Too much can lead to complications and even death, while too little may not be enough to do its job. Weight is one of the main things doctors use to decide the amount. Some of the treatments I'll talk about later are very delicate. The doses have to be perfect. There are devices that are also used to diagnose a heart attack. Many of them also decipher the amount of damage the heart has endured. The electrocardiogram, or EKG, is a device that measures heart rate, heart damage, heart size and position, and the effects of drugs. Electrodes connected to the machine are attached to the skin, which supply the information. It also picks up the presence of creatine phosphokinase, a cardiac enzyme that elevates during a heart attack. This enzyme is used to confirm the attack and measure the extent of the damage. The EKG is normally placed at the bedside, along with in the nursing station, so doctors can be on the lookout for irregular heartbeats at all times. The echocardiogram is a machine that looks at the valves and chambers of the heart. It helps isolate abnormalities and determine the extent of the damage the heart has taken. There are many methods of treating a myocardial infarction, many different approaches a doctor may take. Some medications are taken sublingually, which means swallowed, or intravenously, which is through an IV. Nitroglycerin, not the explosive, but the medicine is used to dilate the arteries around the heart, therefore increasing blood flow. Morphine is a narcotic with similar effects and also a powerful painkiller. Even aspirin is helpful. It makes the platelets less likely to stick together. In order to effectively treat a blood clot, there are two common approaches: angioplasty and thrombolytic therapy. Thrombolytic therapy is using medication to break up blood clots instead of a more invasive method. Tissue plasminogen activating factor, or TPA, is the most common thrombolytic medication, used to dissolve blood clots and reopen clogged arteries. Streptokinase, redoplase, and tenecteplase are other examples of this type of medication. Angioplasty is a procedure used to open a clogged artery by inserting a balloon catheter and inflating it, therefore opening the artery and restoring blood flow. Choosing to use this or TPA is really up to the doctor. Neither approach has proven to be dramatically more successful than the other. Many issues can occur during or as a result of a myocardial infarction. These include disorders and arrhythmias that can prove to be just as deadly as the attack itself. Ventricular fibrillation, or VFib, is a severe arrhythmia. Instead of the heart's electrical pulses occurring at regular intervals, the circuit is interrupted and becomes completely chaotic. These random contractions allow no blood flow to the heart or brain, resulting in further ischemia. The doctors start out with cardiopulmonary resuscitation. This supplies the body with oxygen, yet won't stop the arrhythmia. To treat it, they begin with a precordial thump. If that doesn't work, they proceed to use a device called a defibrillator. This produces an electrical shock in order to return the heart to its normal rhythm. If the heart remains in VFib, the patient is given drugs such as lidocaine, as well as epinephrine or adrenaline, then continues to receive jolts from the defibrillator. Two other possible complications are pericarditis and cardiogenic shock. The latter is a condition where the heart is so severely damaged that it is unable to supply enough blood to the rest of the body. Pericarditis is a condition where the pericardium becomes inflamed. The best way to prevent having a heart attack is to exercise often and maintain a healthy diet. However, if you ever do experience a myocardial infarction, at the very least, now you'll know what it is that you're going through.